Welcome to the Heart of Healthcare podcast. Hello, everyone. I'm Halle Tecco. I'm a co-host of the Heart of Healthcare podcast and a new author, and I'm absolutely thrilled to be here today with my friend, Dr. Robert Wachter. Bob and I realized recently that we have something of a twin situation happening. We both have new books coming out at the exact same time. My book, Massively Better Healthcare, The Innovator's Guide to Tackling Healthcare's Biggest Challenges, is really a roadmap for entrepreneurs and outsiders trying to fix our broken health system. It's about navigating the hard parts of healthcare, the incumbents, the incentives, what I call the cranky old guard, and the lessons we've learned from successes and failures of the past decade. Bob's book, A Giant Leap, How AI is Transforming Healthcare and What That Means for Our Future, is the definitive guide to this pivotal moment we're in with artificial intelligence. It takes us through everything from the AI winter of the 80s to the mind-blowing potential of digital twins at places like the Mayo Clinic. Bob, I'm excited to chat with you today.
Thank you, Halle. I will try not to be the cranky old guard, and
Yes.
we should make clear that our books are fraternal twins, not identical twins. So
Yes,
two very
exactly.
different books, and I thought yours was terrific. Thank you.
Thank you. Thank you. And I actually would not consider you the cranky old guard. Maybe the old guard, since you have been around in digital
That's
health
true.
since,
All true.
but not cranky. You've always been so supportive and optimistic about the potential for technology in healthcare. So in my book, one of the rules, as you know, is to work from the inside out. I tell readers that if they want to change healthcare, they first have to become anthropologists of it. And it struck me when reading A Giant Leap that you've really done the exact thing, but the other way around. And throughout your career, you've been an anthropologist of technology and now specifically AI. You studied it, used it. Now you've wrote a book about it. So talk to me about how you've really gone about understanding technology and interpreting it for healthcare folks.
Well, first of all, I'm unburdened by understanding anything about how the tech works. I'm not a technologist. I'm not a computer science person. I was a poli-sci major in college. So I think about the system, and I'm the quintessential insider. My day job is I run the Department of Medicine at UCSF, so I've got 1,000 doctors in one of the world's great academic centers. So I kind of understand what it's like to be a doctor, which I am. I still practice. What it's like to organize medical care, how a health system thinks. The anthropology part of it was going out and understanding how the technology works, how technologists think, how investors think. I'm lucky enough to both be in San Francisco, so I kind of breathe the air of AI, as well as advise a whole bunch of different companies and on a few boards. But I like that point in your book. I think it's absolutely right. I think that healthcare, I've had tech people come and say, well, I'm going to disrupt healthcare because I did fintech. Or I did real estate. And it was like,
Yeah.
okay, good luck. But the incumbents are incredibly powerful. The field is quite regulated. You can't fail fast because you can kill somebody. And you better understand the incumbents and how the system works and how payments work, or you're going to get it wrong. And we've seen that over and over again. We've
Yeah.
seen, the best companies in the world like Google and Microsoft try their hand at healthcare and not get it right. I think now is different because the AI is different, but I think you're absolutely right. You've got to understand how the system works
Yeah.
and how the incumbents think.
Now, when you started kind of hanging out with tech folks in the Bay Area, were they welcoming and excited to have you there and asking questions? Or did you find a kind of skepticism of who's
A little
this
bit of
doctor?
both. Yeah, I mean,
Yeah.
I think for many of the more boastful and naive ones, I am just another dinosaur. And a place like UCSF, one of the great healthcare delivery and medical schools in the world,
Yeah.
is just another legacy organization that ultimately will go away the way that has happened in every other field.
Yeah.
And I can understand how they came to that understanding. If you built Uber or Zillow or Amazon, you were used to incumbents saying, we're a store, we're Macy's, we're whatever, disrupt us.
Yeah.
And they always succeeded. So in some ways, they had to learn that when incumbents like me say healthcare is different, we weren't BSing. It is really different. You have to understand the stakes are high. The regulatory environment is tricky. The payment system is unbelievably convoluted. The system itself is wildly Byzantine. And if
Yeah.
you don't understand that, maybe you can innovate at the margins, maybe at consumer-based. If you're selling directly to patients, fine, there's some room to do your own thing. But if you're taking care of sick people, you are going to have to deal with doctors, nurses, health systems, insurance companies. And so I think the smart ones welcome me because they recognize that that they needed to learn. I remember meeting early on with Hemant, the CEO of General Catalyst, a very
Yep.
smart dude, who had read a prior book I wrote on healthcare going from paper to digital. And he said, I want to come and watch you and watch your people and essentially be an anthropologist. And of course,
Yep.
he and others like him, like were left just scratching their head. They couldn't believe how convoluted the system was, how screwed up the system was, but also quite respectful of what doctors do and what nurses do, and recognize if they slowed down our workflow by a nanosecond, we would
Yeah.
not accept it. So I
Yeah.
think the smart ones get that you have to understand the system as it exists.
Well, and then Hemant went and bought a hospital in my hometown of Northeast Ohio. What are your
Yeah.
thoughts about tech VCs buying hospitals?
Well, it's the first time. This is really the first time that a VC has bought a health system. And I was at General Catalyst's conference, a very swanky conference in Napa last year, and
Yep.
one of their leaders, as Hemant or someone else was talking about this purchase of Summa healthcare system, said, "Well, this is kind of interesting. You have a sort of struggling hospital in a flyover Midwestern town, and
Yeah.
you have a bunch of West Coast elites flying in to help." And she
Yep.
said, "What could go wrong?" So I think about it, I think it's brilliant. I think that Hemant's insight was that we have a whole bunch of portfolio companies that they're working on AI and other digital tools to transform healthcare in a whole bunch of different use cases, the payment system and clinical decision support and scribes, et cetera, et cetera. And if each one we have to test independently and find partners, we're probably not going to go as fast as if we own an ecosystem and try it out and see what we can learn from that experience. And
Yeah.
he said to me when I interviewed him for the book, he said, I'm not naive. I get how hard this is, but I think we've got to figure out an integrated solution across all of the
Yep.
different use cases. And this, I think, expedites that. And it wasn't all that expensive when you look at how much money they have in their fund.
It'll be so interesting to see how that plays out.
It will
So
be
when I
fascinating.
first came back to the Bay Area after getting my MBA and starting Rock Health, UCSF was one of our early partners, and I was on a council of outsiders who were tasked with helping sift through internal ideas from researchers and academics that wanted to start companies from the inside out. And what struck me at the time was that they knew these problems intimately, but didn't
Mhm.
necessarily have a grasp of all the potential solutions and would kind of just jump to the one solution that like they kind of knew of. And then on the opposite side, tech people that didn't have healthcare experience and didn't take time to understand the stakeholder and the problem they were working on would very broadly say, well, this is a cool new technology. Let's just apply it to healthcare. And probably needs to be a mix of both, right? Like we need to intimately understand the problem that we're trying to solve, but we also have to know all of the potential solutions and not be so wedded to one. And I talk about this in my book. Like, you have to be willing to change your mind in the face of new data. And so if one solution isn't working, let's test out another one. I'm curious. I mean, that was 15 years ago. I'm curious if you've seen the culture of innovation and willingness to try new ideas change over this time and now, especially with AI.
Yeah, I think so. In part, our training wheels were the electronic health record, where we it's really for the first time brought in a
Yeah.
technology that was what is sometimes called a general purpose technology. Meaning people sometimes say to me, like, why are you folks such Luddites? And I say, are you kidding me? Like, come to the radiology department. We love our gizmos. Come to cardiology or the OR.
Yeah.
We got electronic digital toys everywhere. But those were very discrete use cases that lived in a very specialized niche of the organization,
Yeah.
only had to be used by specialized people. What we're not good at, and we've never really done before until the electronic health record, was bring in a technology that transforms the entire nature of the work. And so I think we learned a lot of lessons from that. I think it didn't go particularly well. I wrote a book 10 years ago about why doctors hate their electronic health record.
Yeah.
But to me, it was an important scaffolding. Not only we needed to get our data in digital form before we could do anything, but also it helped us learn about technology, about innovation, about governance, about how do we balance privacy and security risks without stymieing every new thing. How do we think about, when do we do a pilot, but when is it time to scale? And, I think the reason this time is different, and when I say this time, I mean the new AI,
Yeah.
is two things. One is the technology is just remarkably better than anything we've seen before and
Hmm.
has the capacity to solve a whole lot of administrative paperwork problems and to basically act like a doctor in ways that no technology could do before. But the second reason that I think our time is now. The story I've told is that, on November 29th, 2022, the day before ChatGPT came out, I wasn't sitting there saying, Google stinks. I need something better than Google for search. In fact, I
Yeah.
couldn't imagine anything better than Google. But on November 29th, 2022, I don't know anybody who's saying the healthcare system is just perfect. And
Yeah.
we don't need to do any, no doctor said that, no
True.
nurse said that, no patient said that, no purchaser said that. And so I think it's the combination of the technology is magical. We
Yeah.
have gotten used to digital transformation over the last 10 years, even if we've done it poorly. And the needs of the healthcare system are so profound and so obvious that you can't fix it unless we
Yeah.
bring in this kind of technology.
Yeah. You talk so much about trust in the book and how important that is. And in kind of the history of EHRs, that made a lot of clinicians' lives miserable,
Yeah.
frankly. And the pajama time that was then required because of the EHR, I think a lot of clinicians lost trust with tech. I'm like, this is only causing problems in my life and making my job harder. But
Mhm.
then COVID happened and hospitals had to and clinics had to respond very quickly to remote care. And what I see happened was that trust was actually rebuilt
Mhm.
and the culture changed within providers and the capabilities to quickly vet, adopt, and scale technology was just night and day, right? Like it took billions of dollars for meaningful use to get EHR
Right,
to
right.
ubiquity, right? Like we had to pay doctors to do it and they still hated
Shocking,
it.
but true, absolutely.
Yeah, but COVID was this incredible reckoning for tech, and I think that where we are 5 years later, if we hadn't had COVID, we would not be where we are today in terms of trust and the capability now of providers. And now we're seeing that providers are leading the charge across all industries in terms of adoption, which is
Yeah.
just so cool to see.
Well, I think it's a profound thought that in many ways, maybe you could imagine, you could say that the first technology that we sort of learned that, wow, this is cool and it actually helps us do our work was Zoom. Was like,
Yeah.
okay, I have to close my office, but all these sick people, I need to manage their blood
Yep.
pressure and their asthma. And now there's a way of doing it. And the adoption curve for telemedicine
Yeah.
had been glacial. And all of a sudden it went from 1% to 80% in a month. And
Yeah.
so it was like, oh, this, and it really was for the first time, we had to get out of our mind space that patients come and see us in an office and they check in and we see them in 15 minutes and they go home. And now we're in a world where some of the monitoring will be done through wearables and
Yep.
through their watch, et cetera, and we can actually meet them where they are. I
Yep.
think as we move into the new AI, it was very important to recognize that there's a lot of skepticism in the medical world about AI and technology generally. It's been overhyped
Yeah.
in the past and mostly has not lived up to the hype. And so as we start bringing it into health care systems, I'm sitting here in my office at UCSF. We have 4 or 5,000 doctors here. All of us have access to an AI scribe now. That's a tool that didn't exist 3 years ago.
Yeah.
And
Incredible adoption curve.
it's not a game changer. It is massively satisfying. It allows me to look my patient in the eye while the
Yeah.
tool creates my note. We all have access to a chart summarization tool. 1 out of 5 patients has a chart longer than Moby Dick. So the idea that I'm going to be able to read that and summarize in 3 minutes is a joke. We just rolling out now access to a tool that will draft a discharge summary after a complex hospitalization. I think it's smart. These are all singles. They're not home runs. The real home
Yeah.
run is robust clinical decision support or helping me with diagnosis. But you want to start by gaining trust by the docs, the nurses, others using these tools and saying, it works. It works well.
Yeah.
It's not disruptive. It makes my life better. It helps me focus on the patient in a way I didn't before. I think it's building the kind of trust that we need to build before we then move on to more ambitious use cases.
Yeah. I mean, the fact that so many clinicians are using open evidence that's not even integrated into the workflow, like
Exactly.
picking up their phone and using this extra app is really telling. So we've seen a lot of tech companies attempt to tackle healthcare with varying degrees of failure. You talk about one of the biggest failures, which I had really forgotten about, which is the IBM Watson case, which I want you to comment on that for the listeners. But I'm just curious how you think this new wave of tech companies, namely OpenAI and Anthropic, will do, given Google, Microsoft, IBM have kind of been in and out of healthcare. None of them have really figured it out and nailed it yet.
Yeah, I think the marketplace is just fascinating. I think often people pose the tension as being the behemoths, whether it's OpenAI or Google or Amazon, versus all these startups. And I would throw in a third option, and the third option is Epic or now Oracle. There is a world in which the incumbency advantage of having built your electronic health record, having all of the data,
Yeah.
and not only the data and the tools that the doctors and the nurses are using, but the tools that the patients are using. I mean,
Yeah.
more than a couple 100 million people are on my chart, and that is where they get their care.
Yep.
So, the behemoths are too big to fail in healthcare, and yet they almost always do fail. And the reason is they're just too far away from the workflow, and healthcare turns out to be a far harder
Yep.
problem than the kind of problems they're used to. I think this time is going to be a little different. Amazon just rolled out a pretty cool AI tool for One Medical clinics that they now own. I
Yep.
just had a preview of Google's conversational medical chatbot that they're testing now with Included Health. It's pretty spiffy, and it's been trained on millions of conversations. But I think the pole position here goes to Epic. I think the pole position goes
Yeah.
to your electronic health record vendor. You already have a trusted relationship with them. They are rolling out AI tools for everything, and I think Epic has become a little bit like the old IBM. The old saying that nobody ever lost their job going with IBM. The new saying, I think, is if you're a health system, here's a startup. It's built a really
Yeah.
cool tool, but you're not sure they're going to be in business in 3 years. And there's integration issues if you buy it. And Epic's building a tool and it'll be out next year. And it won't be spectacular, but it'll be good. So I think we will have to see. The Watson story was there was AI in healthcare 40 years ago. It completely flamed out because it wasn't ready for prime time. We went into something we call the AI winter in healthcare, which is there was basically no talk of AI for about 30 years. Then Watson beat the Jeopardy champions. And if you watched it, you couldn't help but saying, oh, doctors are toast. And then they tried to roll out in healthcare. And it was basically all polish and no shoe and marketing well before data.
Yeah.
And everybody tried it. And it was like, nah, this thing isn't very good. And IBM sold Watson for parts at a loss of about $3
Yeah.
billion. So that was, there have been a lot of tries. I think this time is different because the tools are so much better and the
Yeah.
needs of the healthcare system are so profound.
Well, and the product came first. First the product, then the marketing. So it's
Yeah.
different.
Yeah. Yeah. And,
In
and
your
I
book,
think we're not going to get snookered this time. We won't fall for the fancy PowerPoint slides and
yeah.
a place like UCSF, when we are looking at an AI tool, we're going to vet the hell out of it. And we're going to look at the data that shows that it really works and that it doesn't
Yeah.
hallucinate and that they've figured out the privacy and security stuff and that it integrates into
Yep.
Epic seamlessly. And if it doesn't, we're not buying it.
Yeah. Well, and just a note on Epic, but they're being sued by the state of Texas, of all states, for anti-competitive behavior. And they've had lawsuits from startups in the past saying that they have really crowded them out of the market by promising customers similar features that aren't even really on the roadmap. So it's interesting to see, and it will be interesting to see how this plays out, because Epic isn't known for playing nicely with startups. Yet they are that system of record in a lot of hospitals and have that advantage. So they have the workflow advantage.
And they're
but
pretty
they need
good.
to
I
play
mean, I
nicely.
was talking to a chief medical officer of a very good startup that I advise, and he said, damn it, they're pretty good. The AI tools that they roll out may not be perfect. And how could they possibly be as good as a tool built by a company that's the only thing
Yeah.
that the company does? But they're pretty good. They're going to get better. The integration with Epic's going to be seamless. And
Yeah.
Epic's going to be around 5 years from now. So they have a
Yep.
pretty decent size advantage.
Yep. Okay, speaking of lawsuits, in your book, you talk about how 10 years ago, we all thought AI was going to take over radiology. That hasn't happened. And
Yeah.
you mentioned one of the reasons is that missed cancer is the most common cause of successful lawsuits against radiologists, which was interesting to learn. So in my book, I talk about the rise of direct-to-consumer full-body MRI scans, and I help readers think through how to evaluate the pros and cons of such an innovation. So kind of a thought bringing these two together is recently Prenuvo was sued after a 35-year-old got a $2,500 scan that said everything looked normal despite clear narrowing in a major artery. And 8 months later, he had suffered a catastrophic stroke that left him partially paralyzed. This is obviously a case of, and there was a real radiologist that signed off on an AI created report.
Mhm.
So this is a case of, a false negative. Here's your take on that and how AI. There's some speculation that was the radiologist depending too much on the AI report and didn't use his own eyes. Did you look at this case and have any thoughts on that?
I haven't seen. I know basically what you said about the case. I
Yeah.
don't know about a lot in detail, but I guess the thoughts that come to mind. I had a piece in the New York Times last week where I said, we need to be the old Joe Biden line, don't compare me to the almighty, compare me to the alternative.
Yeah.
Doctors are not perfect. Doctors miss things all the time. And what I worry a little bit about is if we hold AI to a standard of complete perfection and then it
Yeah.
misses it and we say, I told you AI was not ready for prime time. I mean, I take a Waymo about once a week in San
I love
Francisco. It's
Waymo.
demonstrably safer than a car with a driver. And yet it ran over a cat in the Mission District a month ago and became a national story. The
Headline
poor
news.
cat
Yeah.
is like the picture of the
Yeah.
cat is in every window, of
Meanwhile, drunk drivers are
meanwhile,
killing
drunk
people.
drivers,
Yeah.
people using their,
Regularly.
on their cell
Yeah.
phone and
Yep.
texting while they're driving. There will be errors. What the Prenuvo case may say, though, is we're going to be in this funky position for a while where the AI is going to be good enough to be useful, whether it's doing scribing or suggesting diagnoses or reading an X-ray, good enough to be useful and
Yeah.
not perfect. And so the system will, of course, be the doctor in the loop. The doctor will have the final sign off. That's a pretty fraught system because humans stink at being vigilant when they're
Yeah.
overseeing a tech that they've come to generally trust. And we know
Yeah.
that when we look at the Tesla accidents where the driver was supposed to be awake, even though the car was on autopilot. Like, how's that going to work? And humans de-skill over time. They get less good. So
Yeah.
I think we're going to see cases like this where the AI did its thing. It's not autonomous. The final person opining was supposed to be the human. The human did it, signed off, and it was wrong and missed something. And I think the trick is to be sure that we don't push back so hard on the AI without looking and making an apples to apples comparison. It was just a study that came out looking at AI enabled mammography, and it was spectacularly more successful than plain human mammography in terms of finding lesions, saving time for the mammographers. I think it's now at a point where it's demonstrably better than the humans by themselves. But these cases will land very heavily.
Azella joining us. Hi.
Hi. I'm
I'm
so
not sure how that
sorry. I
happened, but
have to
hi.
take
You
over.
have a comment. Chime in,
Yes.
please.
I actually work at Prenuvo in the AI research department. And so I
Amazing.
thought this
Yes.
was relevant. It wasn't AI. We don't have an AI that tells the radiologist that this is an aneurysm. So I just wanted to clarify that that was fully a human who was reading the scan, and that was what they decided. We are working on things that could mitigate that issue now.
Yeah.
Good to know.
Just wanted to clarify that it wasn't AI.
Okay. There was a study, and it didn't have to do with radiologists specifically, but there was a study last year or 2 years ago that showed that actually AI alone performed better than AI plus clinicians. Did you guys see that?
Yeah.
Remember that study that came
that's
out?
a study that was this Harvard Stanford study where they looked at a measure of diagnostic reasoning. The humans by themselves scored about 65%. The humans with AI help went up to 67 or 68%. But the shocker was AI by itself was 90%.
Yeah.
And what it says is there will be times now where the AI gets so good that the human looking over its shoulder serves only to screw things up. And so we've got to be very attentive to that because the AI is going to get better and better and the humans are not.
Yeah.
And there will be cases where you actually do not want the human in the loop because they'll make things worse.
Like what? Like what would be a case where you don't want the human in the
I
loop?
think if we get to the point that the AI can read a mammogram or read a CAT scan looking for, lung cancer and its accuracy is 99%, but we say for regulatory reasons or billing reasons, the human will look over its shoulder and the human will be the final arbiter. There's a decent chance that the human intervention that says that thing that the AI called cancer, I actually don't think it is. There's a decent chance that the AI is right as compared to the humans. More and more things like this where and I think it's something we're going to have to really study and think, be very thoughtful about what is the right way of piecing together humans and the things that humans are really good at, the things that AI are really good at, and not just take as a given that having the human be the final sign off is the right way to go.
Can I add one last comment and then I'll jump off?
Yes, please. Please. Yes.
That is literally one of the things that we're working on now is where do we put AI in the process? Do we put it before and have it have higher sensitivity? Or do we put it after? But the thing that is a struggle that we're running into is that to teach the AI, you need a homogeneous set of data that says that every radiologist measures a prostate the same way. And part of the struggle now is if every radiologist measures it differently, then to your point, Bob, they could say after the fact that it's wrong, but based on what we told it to do, and this is what counts as an aneurysm, the AI could be right. And so there is also that kind of struggle of figuring out how do you teach the AI when every radiologist is nuanced in what they consider an aneurysm or a problem.
And this is partly why radiology has been such a tough nut to crack. I mean, the story I tell in the book is of Jeff Hinton, the founding father of generative AI. giving a very famous talk in 2016 where he said we should stop training radiologists today because it's clear that within 5 years, namely 2021, we won't need any more. And obviously he was been right about a lot of things, but he was dead wrong about that.
Yeah.
It's just harder than people think. And I'm glad your company's working on it because somebody is going to crack the code. Before or after question is fascinating because there's another aspect, though, that I think is worth thinking. I think about it from a medical education standpoint. I would actually love the tool to weigh in after the radiologist already weighs in so that it maybe doesn't facilitate de-skilling. And it's the same way that your grammar checker looks at what you wrote and then weighs in about what you wrote as opposed to writing the essay for you. And so there's all sorts of tensions marbled through these design decisions. And I think that's one of them. I think we're going to be more likely to preserve the skills of the physicians, the humans, if they go first in the AI. Oh, I agree with you with A, B, and C. And it looks like you didn't say anything about that thing up in the upper left corner of the X-ray. You should take a good look at that. I think that's probably going to be a more effective system.
Sounds good.
Amazing.
Well,
Well, thanks for tuning in. I'm not sure how you did that, but I'm so glad you're able to. Good to see you. So in terms of things that we think AI will be doing or won't be doing, I'm curious your take on AI prescribing. We're seeing this at a pilot in Utah for refills, which is a use case that makes sense.
Incredibly exciting.
Yeah. How far can we take that?
I think that's the first tiny, tiny baby step into a world that will not be the last. So the story is a company called Doctron. It's actually formed by a UCSF surgeon that I actually met with him yesterday talking about this. They are doing sort of AI-enabled urgent and primary care, but then pitched to a sandbox program they have in Utah that's looking for innovative AI solutions. And how about we come in and can we refill prescriptions? And I think it was a really smart first use case because it means that a doctor has already prescribed the drug in the first place. No doctor wants to refill prescriptions. It's incredibly frictionful for patients. They don't like it. And it's something that obviously AI can do. If I go to AI and say, can you refill my Lipitor? And it asks me a few questions about side effects and am I on any new drugs? And the answers are fine. It just seems like it's uniformly good. It's in some ways a no-brainer. But I think it's clearly the first step into a world. In a future world, a patient comes in with a bunch of symptoms and the AI says so and so and so and so, and here's what the diagnosis is. The patient, I think, is going to insist that the AI then be able to prescribe a medicine. Yeah. And I think we're going to have to figure out, is that safe? Is that not safe? And do it in a way that's not too bound to the guild of medical practice, but says, and I actually think there's going to be wiggle room there because the primary care system is just failing. There's no way. There was a study a few years ago that said the average primary care doctor, if all he or she did was just prevention, the things that, we need to do to prevent, that's 27 hours a day. That's if no patient has the temerity to actually be sick. That's 27 hours. It can't possibly work. And so I think the future primary care system will be urgent care complaints are dealt with mostly by AI, at least as a first pass, maybe triaging to a doc if you have a particular problem. My cholesterol, my blood pressure, maybe my diabetes, my asthma, my vaccines are all managed between me and AI.
Yeah.
I think that has to happen. And I think it's actually going to be good for patients and probably good for doctors because then the few primary care doctors that are remaining will be able to focus on the complex problems that really need them.
Yeah. I know my PCP would love to have a digital twin because he doesn't like being in his inbox at night answering all of our silly questions. When you have patient panels that in 2,000-3,000 patients, it's impossible. So we'll see if that happens. What about 15 years ago, I don't think any of us would have ever imagined that someone could say, I need Prozac, I need Rogaine, I need one of these prescriptions, and I'm going to go online and buy that prescription. And now we have Hims, which is a $13 billion company, Ro, and we have a slew of these digital health companies that have scaled by selling those prescriptions, and we've completely flipped the process for getting a prescription. You used to go with your symptoms, and your doctor would tell you the prescription. Now you can just, for a lot of these, it feels like those clinicians who are behind the scenes working at places like Hims and Hers have a job that AI could replace.
Probably, or at least scale in a massive way so that the AI is doing the first pass. And for all I know, that is what's happening today. I mean, it's you think you're talking to a doctor, but maybe you're talking to a bot. And there's an exception process that feeds it to a doc when, 1 out of 10 patients has something that violates whatever the standard is.
Country, yeah.
You know, I think that's the way the world is going to go. I mean, there's just no question that if you look at the uses of GPT itself for healthcare, it is massive. It is like the real live democratization of care, and patients are going to insist
Yeah.
on why do I need to see a doctor. I'm okay with that as long as we are pretty thoughtful about like what are the escalation strategies, because there will be times where the AI does its thing and it's wrong. And I did a piece with the Washington Post with Jeff Fowler, who's their tech reporter, a few months ago. He showed me 12 patient queries to GPT, and GPT gave answers. Some of the answers were great, were just fine. And some of
Yeah.
the answers, a couple of them were dangerous. And so, you know, the tools have to be good enough, and we're probably going to have to create a new regulatory environment that tests them sort of like we do board certification for a doctor. You know,
Yep.
do they answer real live patient questions correctly, often enough that they can be trusted? Do they have an escalation strategy that when they're getting out of their comfort zone, it goes to a doctor or another health professional? I think that's probably a better world. And again, don't compare me to the almighty, compare me to the current system. Try to find a primary care doc in San Francisco if you don't
Yeah.
have, concierge care.
Yeah.
It's really, really hard. So I think this is all pretty exciting.
Yeah. I agree. Well, Bob, this was a really fun conversation. Appreciate your time today. I hope you enjoy your book tour and
You as well, Holly. Congratulations. And hopefully they'll both be bestsellers and
yes, here. Let's so everybody
fraternal.
can get our
Well, here we
books
go.
on.
Here
Yeah,
we go. Buy both
let's
of
get
them.
a good
If you can only afford one, buy mine. But if you need both, there we go. And
well,
they're
maybe we
pretty
can
different. We come at the world from
they
slightly
are.
different angles. They're pretty
They are.
different.
I think they're very complimentary. If folks are interested in becoming an innovator, that's who I wrote this book for. But everybody needs to understand AI in this current moment, no matter your role. It's a fun read. I really enjoyed it.
Thank you.
It was like a history along with kind of like current events, and remarkable how you were able to do it so quickly, because I feel like things are moving so fast, but it was still very up to date.
Yeah, the challenge was make it up to date, but also make it so it's not out of date 5 minutes after it comes out. So I
Yeah.
really tried hard to think about what are the big cosmic issues that arise
Yeah.
with this, and that was really fun to do.
You can't write an evergreen AI book, but it'll
Did my
still be up
best.
to date for a little bit. So,
Yeah, exactly.
all right. Well, thank you. Thank you everyone for joining us, and we'll see you next week.
Sounds good.